4 out of 5 members of the Board of Health are here with our new member, Sam. But we have 3 who can vote on the current proposal, so we'll start our meeting now. And we'll start with a roll call. My name is Israel Molina. I'm the chair of the Board of Health. I'm a physician. I work at MIT Medical and at CHA in the Everett Hospital.
I'm Dean Exeris. I'm a board member, and I'm also a physician at MGH here in Chelsea.
I'm Mario Fernandez. I'm also a board member and a physician assistant at Boston Children's.
I'm Sam Malorano, new member, Board of Health, and I'm a psychologist in Brookline.
Do you want to introduce anybody else? That's it?
Yeah, this
All right. So the first thing that we'd like to do today is consider the adoption of the November 19th, 2024 minutes that we had last month, where a lot of the community came in and discussed their thoughts about the nicotine-free generation proposal. Is there a motion to approve the minutes as distributed from November 19th?
Do you want to give a little background or
Sure.
remind people a little bit about what it's about?
Sure,
Yeah.
and feel free, anyone, to jump in. This current meeting is being recorded. We have our recorder over there, and this will be available to the public for future review if needed. So we considered a proposal for a nicotine-free generation, which essentially will limit the sale of nicotine-containing products to anyone born on or after 2020, essentially January 1st, 2020, January 1st, 2004.
Before that, rather than after.
Jesus Christ. On or born on or after the first, on or before. Jesus, on or before January 1st, 2004. So essentially anyone who is currently 20 years old would not be able to purchase nicotine in the future in the city of Chelsea. We heard from some outside groups who had submitted some letters as well as discussed their concerns. I think most of the concerns revolved around current personal liberties, the effect on local business, and questions about whether the Board of Health had the legal standing in order to perform something like that. We had, and also we had a couple of residents, specifically I think counselors of the city of Chelsea, who also had opinions about why it should not be passed. We had members of the public, both local and outside of Chelsea, who discussed their considerations for the proposal, including effect on current youth. We had some doctors who discussed the potential impact on pediatrics. We had lawyers who came in and discussed the current legal standing for other cities to consider it and its support in the Supreme Judicial Court. And then we adjourned after that. It was a long meeting. Were there any additions that you guys had about what you heard that day or had considered?
I mean, I think what's important to remember, and obviously we're on record here, is that boards of health all across the country are comprised of either elected or appointed members whose sole responsibility is to look out for the health and well-being of the community that it serves. And they often do that sometimes with more restrictive regulations that actually go above state regulations. And they're allowed to do that as long as they don't violate state law. And so we just want to make it clear that this Board of Health has the right to do this regulation. And I've been on the board for almost 20 years, and when I first started, we were telling companies in Chelsea how to operate their business so they didn't have smells that affected and impacted the community of Chelsea with the way they did their leather processing. We have also banned artificial trans fat in the city of Chelsea in all food service establishments. We told businesses that they can no longer use artificial trans fat. And that's not just the 0.5 grams that were allowed by the FDA, but a true zero trans fat ban, because we knew that the residents of Chelsea were actually more unhealthy. We saw the data from all over the Department of Public Health around cancer and heart disease, and artificial trans fat is made in a laboratory. There's nothing good about artificial trans fat. So we were able to do that. And then through the years, we've been able to see the changes in the tobacco regulation based on other communities that started raising the minimum legal selling age from 18 to 21. We followed suit soon after and heard a lot of concerns about how that's going to impact businesses. We decided to do that anyway because, again, our motivating factor, our driving force is really taking care of the health and the well-being of the residents of Chelsea. We also changed the flavor regulations a few years ago, and now we're confronted with a nicotine-free generation. So we did hear a lot of people that were opposed. We heard a lot of people that were supportive. And our job was to listen, and I think we did that. I reviewed some of the information that we got and received since the last time we met. We made a motion actually to postpone the discussion and the voting because we wanted more time. But we heard from young people who supported this. We heard from businesses. We heard from council members, councilors, city councilors. So we did. I think we did our due process, and I think what's important to remember is that this board of appointed individuals has the right to do this. So however we decide, but I just wanted to sort of say that on record.
Yeah.
I don't know if you have anything else.
No, I agree. I think that's important to recognize that we do have the authority having appointed the authority to do that. And certainly listening and hearing the people's input was critical. Specifically, I speak for myself only, but I think that was good to hear people's opinion from various age and background and professions. So yeah, thank you all for those inputs.
Before we proceed, Mr. Chairman, I have a request for a motion to clean up a part of the draft that we have before us.
Sure. Can I just read the support from Jessica Wins with regard to...
It's at your pleasure.
So our other board member who is not here, who couldn't be here because of a conflict, did submit a letter, which I think will be available to the public later. But I just wanted to read it so that people are aware of another person's opinion. She writes, "Dear fellow board members, I apologize that I'm not able to attend in person due to conflict, but I would like to share my support of the tobacco-free generation health policy for the city of Chelsea. As a supporter of youth programs, this is an opportunity to build a stepping stone for our children's health and grow the life expectancy rate in our community. Out of 10 eastern Massachusetts cities and towns with a population of 30,000 or more, Chelsea falls on the list at number 8 with a life expectancy rate of 77.4 as of 2017 to 2021. As Atris Health Equity Foundation reported, this modest improvement warrants the question, are we seeing the results of community-wide investment and interventions or the displacement of low-income residents with poor health with an influx of healthier residents due to gentrification? Better understanding these dynamics will be essential to advance health equity for all in Chelsea," end quote, highlighting the critical need for intervention in our community's health. In 2018, the city implemented a ban on mini bottles of alcohol, I think known locally as NIPS, and it was transformational for our city. Alcohol-related emergency calls decreased, and there was an overall positive impact on public health and litter. I hear the concerns from retailers, but I would like to remind our community, businesses are still thriving from this change and will continue to do so. The city of Chelsea continues to be a prime example of how to react in a time of despair where our community's health was at risk. By adopting this new policy, we ultimately will create a healthier future population that will continue to build upon our city.
So thank you, Mr. Chairman. So I'm Streff Treadway, Assistant City Solicitor. In reviewing the draft regulation, Director Amaya noticed that there was something that is a clear error. As the chairman and the members have previously pointed out, all of the debate was whether or not somebody born after January 1st, 2004 would be able to purchase tobacco products in Chelsea. However, Section 3A regarding identification of people attempting to purchase tobacco read that each person selling or distributing tobacco products shall first verify the age of the purchaser by means of a valid government-issued photographic identification containing the bearer's date of birth, and that the purchaser is born on or after January 1st, 2004. Of course, that should be born on or before January 1st, 2004. Furthermore, Section S6 regarding violations said for purposes of certain fines, the Board of Health shall make the determination, notwithstanding any separate criminal or non-criminal proceedings brought in court here under or under the Massachusetts general laws for the same offense. That should be may make the determination. So counsel for the board would request a motion to make those amendments to the proposed regulation.
And sorry, can I interject really quickly? So for 3A, it is purchaser is born on or before December 31st, or it should be purchaser is born before January 1st.
So as to not infringe on anybody's current personal right.
Yes.
So I would make a motion to accept those changes as stated by City Solicitor Treadway. Is that?
That's it?
So,
You speak louder, please.
I second the motion.
All in favor? Aye. So passed. Thank you. Now to move on to the public health reports.
We didn't really.
Yeah.
We didn't.
Debate and vote.
Oh,
Yeah, we didn't really vote on that.
No, that was the on whether or not to amend.
oh, Jesus.
Yeah, that's okay. That's okay. I mean, does anybody have any other comments or discussion or?
I think we did hear feedback from both counselors and some other individuals about the current proposal and its impact on the business community. But I think we also heard testimony both from the counselor and from other individuals emphasizing that the Board of Health's role is principally in terms of managing and making proposals that affect the health of Chelsea residents. And although it can affect business, that is not our primary motive in determining what we do pass or don't pass. Hopefully the city can help support businesses in the community if it is passed.
I think historically this board has been quite sympathetic to the financial impacts of violations and specifically around even selling tobacco to underage populations. We've seen that here in hearings when companies have come. You know, that said, we certainly understand that small businesses over time will be impacted. Now remember that the people that will not be allowed to buy cigarettes have never been allowed to buy cigarettes. So these are for stores that, you know, have never been able to sell legally to this population. So I think, you know, and also to hear the opponents say that if somebody can, you know, fight in a war and come back and not be able to sell cigarettes, we also raised the minimum legal selling age from 18 to 21, and that same argument was at that time. People can fight in a war at 18, but they can't buy cigarettes after we raised it to 21. So again, we are trying to think of the health and the well-being of the residents and the young population who will not have the freedom to quit smoking cigarettes once they become addicted. And I think that's how I've sort of, my years on the board have really been my guiding principle around how I make decisions and how I vote. So.
Yeah, I'm good on that.
So it sounds like many opinions have been made about the current proposal. Is there a motion to make a decision on this?
So I would make a motion to accept and vote and accept the regulations that have been presented to us, including the amendments.
Is there a second?
Yes, I second the motion.
All in favor?
Aye.
We need an effective date.
The current proposal has an effective date that anyone born after
On or after January 1st,
2004
Okay.
would not be able to purchase nicotine in Chelsea. There was a discussion regarding whether that date should be used versus another. And we recognize that there is a small amount of time between now and when that proposal would take into effect. And so there was a question whether choosing 2004 versus 2005, I can't say 2004, 2005, was to be considered. For reference, in other communities, when it has been passed, there was a little bit more lead time to that particular date, and so there was more time to both educate and support groups that could be affected by the current policy. We have not deliberated.
I would, this discussion, right, I would make the argument that we keep the date firm, but maybe consider enforcement, differently. I only say that because when we banned artificial trans fat from food service establishments, it's a very different process because we had to sort of clear the shelves and make sure that people didn't lose money by products that were still that they were using that would now be banned. In this case, again, as we said before we voted, that these are customers that weren't ever, so what are we doing by postponing it to, say, 2005? I don't know what that would accomplish.
Right, I agree. I don't think that, to your point, they haven't been able to purchase these items anyway, so
Right.
it's not really going to change whether it's 04 or 05.
If there's unanticipated hardships that we're just not aware of, and maybe other communities have experienced, then we can certainly, case by case, right? There are hearings for violations, and again, we can take that as it comes, and maybe. What do you think?
I think that your thoughts about it are very rational and make a lot of sense. I think it is appropriate for the board, if in the future, to consider a violation within that first year to provide more education as opposed to enforcing the penalties of the actual provision.
I worry that there's a lot of people that weren't at these hearings, right? That either aren't aware of this or aren't interested, or and perhaps being lenient to first-time violations in the first 6 months, maybe, because they're, like we said, this is going into effect in 7 days, right? It's or 15 days.
21.
So it's not discussion phase yet, but yeah. So.
Okay.
Fair enough. So the regulation has, at the end, a statement that the regulation will take effect on. So would you like that to be January 1st, 2025? So the date in which this provision is enforced.
Yes, that would be how I would say that, yes, we should. Do we need to make a motion for that?
I think you should, yeah.
Okay.
Because it isn't in the draft regulation.
Yeah, so I would make a motion to enact, or what's the word?
To make the
Right.
regulation effective.
To make the regulation effective on January 1st, 2025.
And I second that motion.
All in favor?
Aye.
Thank you. All right. Any other pieces that we need to make a decision on? Okay. So the next piece of our board meeting is to discuss the current public health report, which is sent out to our group. For the public, I'll read through some of the cases. There are no identifying information here. So in the community, there have been some infectious diseases that have been presented. There have been a few enteric, which means like through the gut. There are 4 active cases of tuberculosis. Flu levels in the city of Chelsea, there were 6 and considered low or minimal. The city, through their efforts, were able to vaccinate over 165 people, including people at the senior center, employees of the city, Phoenix Academy, Kappa Head Start, community-wide clinics, senior living on the Hill, and St. Luke's Church. Seasonal flu activity is increasing slightly among children, but remains low nationally. Percent positivity for influenza has trended upward slightly during the past few weeks, and the percentage of emergency department visits for influenza increased slightly among pediatric age groups. With regard to COVID, in the month of November, there were 20 confirmed cases, 1 suspected, and 7 probable. about equal to the last month's. COVID severity currently is low. And then the Mass Department of Public Health is sponsoring 2 free COVID clinics in the community and has provided $75 Walmart gift cards to anyone receiving a COVID or flu shot. One occurred on November 16th, in which 78 people were vaccinated at the senior center. 37 people at that time received both COVID and flu. 29 people just received COVID, and 12 people just received the flu. The next date for that public vaccination drive is on December 14th, this Saturday, from 10 a.m. to 5 p.m., also at the senior center. RSV levels are currently low in the city. Overall, 11.7% of ED visits are due to respiratory disease. Paula, also, who is the public health nurse for Chelsea, included some notes about current news. So CDC issued an alert and confirmed 2 human cases of avian flu in California. CDC issued an alert of the first known case of monkeypox in the U.S. from California. The case recently traveled from Eastern Africa. CDC issued an E. coli alert on bagged organic carrots from Grimway Farms in California. Multiple sizes and brands of bagged organic bags and whole carrots were recalled, and MDPH has observed a significant rise in respiratory illness caused by mycoplasma pneumonia and bordetella pertussis, especially in young children.
So wash your hands.
Wash your hands.
Wear a mask if you're sick.
I don't know what your personal experience has been, but I've seen more non-travel related COVID. I was just in the hospital, a number of patients super sick from flu,
Yeah.
but locally acquired,
Yeah.
but not a ton of cases. And then I don't really have an update about the public health special needs registry safety. Jaleesa.
My name is Jaleesa. I'm the community health worker for public health. For our special needs registry, we currently have 81 residents now. Out of all of them, we've completed 20 home visits, which myself and a firefighter will go into their home and check if their house is safe for fire emergencies or anything like that, just making sure they're okay with that. In the past year, we offered 2 emergency preparedness trainings, which 72 people attended. Around 10 residents from the registry actually went to that training, to both of those trainings. The next initiative for public health is, public health, police department, fire department, and 911 was the safety net, which was launched in November. We currently have 2 kids enrolled. We have 3 scheduled in the next couple weeks to get the bracelet. And as of now, there's nobody pending to sign up for it, but still.
And just so the board know, the Safety Net program, it is an initiative that was spearheaded by our fire and emergency management. And it is a tracking bracelet that uses radio frequency as opposed to GPS. And it is very useful when we have Chelsea residents who are prone to wandering due to specific cognitive conditions as Alzheimer's. And so as Jaleesa mentioned, we have 2 pediatric population right now.
So they have RFID on their bracelet that's
Yes, so each time a person is enrolled, there's a specific frequency and ID, and this is entered into a data system that our emergency management team manages. And if there is a situation where a child is lost or an adult or a person, they can easily activate the search and rescue, and it really cuts down time significantly. And I think we had an experience where they spent, 8 hours looking for a person at one point. And so, thankfully, it was a successful search. And
Thanks for the update.
Is there a place where the public can look for more information regarding
Yes,
this and apply if needed?
yeah, so the Chelsea website, both of these initiatives are highlighted under either public health or emergency management. And it is open. We have the senior center and obviously us enrolling people into these programs. They're all opt-in, so we really do encourage anyone who's interested to reach out to us.
Is that what you want to do?
Yes, we didn't include in our agenda time for public comments, but if the public does have any comments that they'd like to make regarding the
current proposal that was discussed and approved, the public health report, please come up if you'd like.
Can we ask questions?
Yeah, I guess why not?
Well, I was just curious. I'm just learning about this starting yesterday. And I know that substance or specifically tobacco use and vaping is a huge issue for the youth in Chelsea. But I know that it's an issue at the high school and middle school level even, who are obviously not part of the legal age anyway. Are there other cities that have adopted something similar? Is this meant to address that issue, and if so, how?
Yeah, I can go. So based on my understanding, the people who those students get nicotine products from are not retailers, right? They're typically getting it from known contacts, people who are a little bit older than them. And so what this policy helps to address is that in the first year, maybe that's not really going to affect too many 18-year-olds who may know a current 21-year-old individual. But after a number of years passed, that gap is going to widen. And so in, we'll say, 4 years, the 18-year-old may have friends who are 21 or old enough to buy nicotine products, but that individual will not be able to buy it. That person would still have to go to their original contact, who's 3 or 4 years older than them, about 24, 25. And again, that will continue to widen with years. So then you'll have a large gap between current young people and people who may offer them nicotine or obtain nicotine for them. And in that way, you kind of decrease exposure to younger people over time. Chelsea, as its approval today, is the 10th community in the state of Massachusetts to approve a policy like this. Brookline is one of the first places that also did that. And the case has been taken up by the Supreme Judicial Court because they were taken to court by, I think, a retailer. And the Supreme Judicial Court upheld that the Board of Health had the right given to them by the state to pass that kind of policy.
I think in that case it was the Board of Selectmen, but it's comparable here.
Board of Selectmen.
And like other policies, for example, when Needham raised the minimum legal selling age from 18 to 21 several years ago, other communities followed. Chelsea was one of them. That was an early adopter. And then the state took that on, passed a regulation for the state. And then the government took that on and passed that, on a federal level. So we know that there's, with these communities that are going nicotine-free, are we the 10th? Is that what you said? This is the 10th one? This is going to give more traction for the state level. And I know there was a bunch of you guys that went there to the state a couple of weeks ago, right? And they're in the audience here. I forget the terminology, but you sort of are advocating or lobbying for legislation to be passed to actually make this state law and not just
Can you guys also talk a little bit about what you've seen in communities that have adopted this? What are the results? Has smoking gone down among youth?
Are there any negative unintended consequences?
It's a good. Anybody here?
I'm from Brookline, so I can tell you a little bit about what it looks like because that happened 4 years ago. So what we've seen in Brookline is use of tobacco in the high school is a rarity. I was fortunate to have 5 years ago a student in the high school, one of my children, and now I have one in the high school. It's just absolute night and day. My child in the high school now doesn't know anyone, can't even name someone who uses any tobacco product. So I know that that's anecdotal, and we are going to get better data, hopefully soon. But it's made a really big difference because even just a few years ago, it was hard to find someone who hadn't tried a tobacco product. And we know that the industry keeps coming out with new products, and there are even some examples right here in Chelsea that are new products that people are attracted to and try to use. So far so good, and no businesses have gone out of business in Brookline.
And I think we should
sell
just be clear, nicotine products, not.
Nicotine products,
Oh,
yeah.
Oh, sorry, yes.
Yeah,
It's
that's
not-
right, yeah, because it's all the nicotine products that we're talking about.
No kids.
Does that answer the question?
But they all were
Right.
vaping, right.
I don't necessarily understand the distinction, but
Does that answer your question?
It does, thank you.
So the next item for our consideration is the next meeting date. We typically meet every second Tuesday of the month, which is January 14th. Is there any difficulty in attending that meeting on January 14th, Tuesday?
Not.
I don't have any conflict.
Sam? That should be good.
So, wait, do I need a motion for that?
I don't think so.
So we'll set the next meeting to January 14th at 5:30, which is our normal meeting time, second Tuesday of the month. And then after that, it's adjournment.
I make
Yes,
a
ma'am.
motion. What?
Location.
Oh, okay, I mean,
Yeah,
I don't know.
I don't know where,
I'll coordinate the location.
Okay.
Yes, and announce it.
either Williams or here, right?
Yeah.
Or the library.
Yes.
We wait with bated breath as well as to where we're going.
Having gone to the wrong location first, I'm looking forward to it.
Oh, tonight, yeah.
I did, yeah. I went to the Williams School.
So any other,
It's a, no, we can proceed next item.
Yeah.
Okay.
so I'll make a motion to adjourn. Can I do it? It's ready to go, in favor?
All right, where's our,
Who seconded that motion?
Mario.
Mario, second.
I think Sam could have.
You guys are tag team, is that?
Could have, you were here.
I think you could have.
Thanks, everybody.
Good, thank you very much.
Thanks all for coming.
yeah.
Thank you. Thank you for all